So in assessing for the JVP, ask the patient to lie down in about a 30-degree angle, making sure that his or her sternocleidomastoid muscles are relaxed. And then ask the patient to look away from the area of your inspection. So in this case, I'm on his right side, so tell the patient to look in the left side. And then palpate for the sternocleidomastoid muscle, and then deep into it is your right internal jugular vein. Then assess its highest point of oscillation or pulsation, and then measure it vertically from your sternal angle. So first, we check for the point of oscillation, highest point of oscillation, and then we measure it in a vertical distance from your sternal angle. So the distance was about 2 cm from your sternal angle. So normally the normal range, or in the normal range, should be less than 3 cm from your sternal angle, or 8 cm from your right atria. So in this case, since the patient has a 2 cm JVP, it is within the normal range. So in assessing for the carotid pulse, try to inspect first the neck for visible carotid pulsation, and then palpate the carotid artery and then assess its pulsation. It should be brisk or smooth and rapid. So as you assess, try to feel any thrills or any slight vibrations, and then after that, we would check for any bruit. We would auscultate using the diaphragm. So first, ask the patient to stop breathing because it would interrupt the auscultation. So in inspecting for the heart, first we would ask permission for the patient if he could try to remove the shirt or try to lift it up. So, sir, is it possible if you could lift the shirt? We will just check for. We would try to examine your heart. Okay. Sometimes through careful examination, you can see the point of maximal impulse, but usually point of the maximal impulse is not visible. So especially when the chest is muscular or the patient is obese, mahirapan talaga makita yung EMI.
So I will check for hips or lifts, which are any sustained impulses that may rhythmically lift my fingers. So using my finger pads, I will check for the right second ICS, left second ICS, lower left sternal border, and fifth ICS midclavicular line. Alright. Next, I will check for thrills, which are any vibratory sensation on the same areas I checked previously. I will use the ball of my hand to check for any vibration. Alright, so next I will locate the EMI, or the point of maximal impulse. So this is usually located in the 5th ICS midclavicular line. Alright. So once I have found it, I will make finer assessments using the fingertips. And then one finger, I will note for the location, duration, amplitude, and diameter of the apical impulse. Next, I will palpate for the right ventricular area. I will place the tips of my fingers in the left third, fourth, and fifth ICS to palpate for the systolic impulse. Can you please exhale and hold your breath? Alright. So if there is a palpable impulse, I will assess dilation, amplitude, and duration as well. For patients with increased PMI diameter, I will palpate for the right ventricle in the epigastric or subxiphoid area. So I will palpate for the right ventricle using my index finger. I will press it just under the ribcage to assess for any pulsation. Percussion is not usually done in cardiac exam unless PMI cannot be located. So in this case, we percuss in the left third, fourth, fifth, or even sixth ICS from resonance to cardiac pulse. So left third ICS, fourth, fifth, and sixth.
I am now going to perform your auscultation of the heart. So the auscultation of the heart will involve using the stethoscope. The stethoscope has two sides, your diaphragm and your bell, which will pick up the different sounds. So your diaphragm will pick up your high-pitched sounds, your bell will be able to pick up the low-pitched sounds. So technically the bell will work best at the apex of the heart and the diaphragm at the precordial areas of the heart. So moving along, we have different points along the chest where we want to go use our stethoscope on. So starting at the apex of the heart, which is at the PMI, and then working my way upwards the intercostal spaces, stopping at the second intercostal space of the left, and then crossing over to the second intercostal space on the right. So what we want to do now is to put our patient in a supine position with the head elevated at 30 degrees. And then, ma'am, mag-auscultate po ako ng puso nyo. Ang gagawin lang po ay papakinggan lang po natin yung heart sounds. Okay lang po ba yun sa inyo? Yes. Sige po. So I'm just gonna take my time listening to the different heart sounds while I auscultate throughout the points of the chest. And that concludes the auscultation of